Hi, my name is Madison and I'll be the nurse for you and your newborn baby today. It's nice meeting you. I'm going to be teaching you about critical congenital heart disease, also known as CCHD. Critical congenital heart disease is a name given to specific congenital heart defects. These defects occur in the heart before the baby is even delivered, and the defect can cause blood to flow in an abnormal pattern, which may lead to blockage of blood flow throughout the body, and if it's left untreated, it could lead to severe developmental delay or could even cause death in the baby. So this test is very important, and no baby is allowed to be discharged from the hospital before this test is done. Most moms will want to know how this test is done. Is it going to be a long test? Is it going to be harmful to the baby? And the answer to that is no. It's a very simple test. The nurse will come to the bedside with what we use is a pulse oximetry machine. It's a simple bedside test. The nurse comes, puts the sticker on the right side of the baby's hand, finger, or the right foot. This test will estimate the amount of oxygen that's in the baby's blood. The test is painless, it's harmless to your newborn. A normal test will show that the baby's pulse ox is between 95 to 100. And then this test is mandatory on every newborn baby and is critical to be done within the first 24 to 48 hours after delivery. Waiting for at least 23 to 24 hours is preferable because of normal psychological changes that occur in the first 24 hours after birth, which may cause a false positive test. A lot of questions that come from moms is it okay? If my baby's normal, what happens after that? If your baby's levels come back between 95 to 100, then no further testing will need to be done and you guys will be good for discharge. If the baby's level is below 95, don't freak out. We will come back in about an hour or two to recheck that oxygen level. If it's still pretty low, then we will bring a doctor in. The doctor will examine the baby, who will more than likely take the baby for further testing, and those further testings will be an echocardiogram, x-ray, or a blood test, and those tests will tell us what is going on. The symptoms of CCHD have a number of symptoms, including rapid breathing, rapid heart rate, swelling of the lungs, tummy, or around the eyes, a blue tinge to the skin or lips, and the baby not wanting to eat or feed.
I need Frankie.
CCHD is treated depending on the symptoms and the specific heart problem your baby has. Some may just receive a simple medication and it'll fix the problem. Others may need a procedure in which the doctor threads a long, thin tube, which is also known as a catheter, through a blood vessel into the heart. This treatment can correct with blood flow and heart problems early in life. Many babies will need surgery right away in the first few days or weeks of the life, depending. Some need multiple surgeries over several years for their heart defects. The cardiologist will determine which treatment will be best for your baby. And I have my niece here who I'm going to demonstrate how they would put the sticker on the baby. You forgot your stuff.
Hi, Frankie.
So like I said,
Frankie.
Usually they're going to be doing the right side. Here, come here.
Frankie, you want a sticker? Let's do stickers.
If they're doing the finger, they're going to just put it on the right hand. This will obviously be hooked up to a machine that's going to read the oxygen levels. If you keep it on there, there's usually a light that'll pop up and it reads through the fingernail. If you're going to put it on the hand, you're going to want to put it across. And the same thing, the light will light up and it'll read to the pulse ox machine. And if you're going to use the foot, usually, you can use the big toe as well, and once again, where the light is, you're going to want to put it on the toenail, or you can put it on top and it'll wrap around. The baby's foot will be so small that it'll wrap around, and if you leave it there for a couple seconds, it will light up and read from the machine. After you get these numbers, the doctor will come in and tell you if they are good or not, or the nurse can tell you if they're good or not.